All right, so this is our project on the urinary system. It's by me, Erica, Rowan, and Nancy, and it's for our Nursing 260 class, Certified Nursing Assistants. All right, so starting off, the urinary system has four major parts to keep everything functioning correctly. So starting with the kidneys, the ureters, the bladder, and then the urethra. The kidneys act as a filtration system. It filters the blood and it makes urine. And then eventually over time, the body will eliminate that. The ureter is basically two thin tubes inside of the pelvis that carries the urine from the kidneys into the bladder. And that's also where reabsorption happens. And then we have the bladder. Basically it holds the urine until we're ready to urinate, until the brain tells us, our bodies that it's time to urinate and that our bladder is full. Most bladders can hold up to 2 cups of urine. And over time, that amount decreases as we age. And then this is also where secretion happens. The urethra, this tube carries urine from the bladder out of the body. So this is where elimination happens. This is where we pee, basically. In women, it's the penis, and then in men, it's the penis, and then women, it's the front of the vagina. And again, this is where the elimination. So there's four main parts of the urinary system. As far as the urinary system and aging, aging increases a lot of different problems, increases the risk for a lot of different problems to happen, such as bladder control issues like urinary incontinence or urinary retention. The bladder and then like the bladder and other urinary tract infections, and also kidney disease and kidney stones. So aging affects the kidneys and the bladder a little bit differently. So I listed just a few details about changes that happen in the kidneys, and then also changes that happen in the bladder. So as far as the kidneys, the kidney tissue actually decreases over time, and therefore kidney function also diminishes. The number of nephrons, or filtering units, in our body and in our kidneys actually decreases as well. And nephrons are basically used to filter waste from the body. So if you can picture that waste is just staying in the body a little longer than it needs to, because there are less of these filtering units. The blood vessels also that supply the kidneys can become hardened. And so this causes the kidneys to filter blood more slowly. So then there's another part of that is where, toxins are staying in the body longer than they need to. And also the kidneys aren't getting, a lot of the blood that they need to, like they used to, right? Because those vessels are hardened. And then, of course, illness, medicines, and any other, things like that can also diminish kidney function over time as well. Just a quick overview of what happens to the bladder. The elasticity of the bladder, it becomes stiffer over time and less stretchy, so it's not able to hold, that maximum volume of urine, and that decreases over time. And as we age, the bladder muscles also weaken. So, those muscles that we use to kind of like hold our pee in when we really have to go, that kind of diminishes over time as well as we age. So in women, the urethra actually shortens and its lining becomes thinner. So that actually can, we'll go into more detail on that, but that also can lead to UTIs and things like that. And the same in men, the prostate gland tends to enlarge with aging. So over time, that could actually block the flow of urine. So some things that we can do as nursing staff to help with just things that happen naturally as we age, and as these residents age. We can begin urinary training. Also, there's topical estrogen that can be used for women. Um, we can also catheter certain residents. There's also pelvic floor muscle strengthening. We can also use like briefs and things like that, absorbent products. We can also reduce the usage time of the them wearing the wet briefs. And then also just encouraging, food intake and fluid intake, and encouraging them to use the restroom and use the actual toilet instead of, just using the briefs or anything like that. And so passing it over to Rowan.
Okay, observing and reporting. Normal urine is light or pale yellow and clear. Adults produce 1,200 to 1,500 milliliters of urine per day, but elderly people may produce less. Here's what to report to the nurse. Cloudy urine, dark or rust-colored urine, and urine that has a strong or fruity odor, blood, pus, mucus, or discharge in urine, urinary incontinence. It may be a sign or symptom of another illness. If a resident reports pain, pressure, or a burning sensation. Uh, in the corner, this image shows that the urine samples on the left side have a normal color, and on the right side, it's showing that that urine sample has hematuria, which means that there is blood present in the urine. Here's what to report when a resident has a catheter. Each of these should be reported to the nurse immediately. The urine looks or smells abnormal. What I was saying on the last slide, rust-colored urine, dark urine, fruity or strong-smelling odor. If the catheter bag fills suddenly, if the catheter bag hasn't filled for several hours, if the catheter isn't in the right place, if urine is leaking from the catheter, or if the resident is reporting pain or pressure. Urinary incontinence is the loss of bladder control. Urinary incontinence is not a normal part of aging. However, elderly patients are at a higher risk for developing incontinence as a result of another disorder or illness such as bladder disease, neurological diseases, stroke, etc. There are several different types of urinary incontinence. First I'll go over is stress incontinence. This is caused by increased intra-abdominal pressure, for example, coughing or sneezing. Women are more likely to develop this from weakened pelvic floor muscles from childbirth. There's also urge incontinence, which is a sudden, uncontrollable urge to urinate. Mixed incontinence is a combination of urge incontinence and stress incontinence. There's functional incontinence. Someone with functional incontinence may have a normal bladder and urethral function, but they lack the mobility or cognitive ability to be continent. For example, a resident Okay. For example, a resident with dementia may develop incontinence because the messages between brain and bladder don't work properly. There's also overflow incontinence, which is the inability to completely empty the bladder, which leads to overflow, which leads to urine leakage. Men are more likely to develop this kind of incontinence due to an enlarged prostate gland or prostate cancer causing bladder obstruction. And we have a short video to play next.
Incontinence is common in older people, and it causes a fair amount of morbidity and is tremendous suffering and cost. But it's never normal at any age, despite impaired mobility or even despite impaired mental function, and even if you're in a nursing home. In general, it's highly amenable to treatment. About a third of older people's incontinence can be completely controlled. In another third, it can be nearly controlled. And in the final third, are amenable to significant palliation. The approach to evaluating and treating the older patient has to incorporate an understanding of what changes are normal with age, as well as all the other conditions that are present and the medications that are used to treat them, because all of those can have secondary effects on either causing the incontinence or interacting with the treatments that you're going to do for the incontinence. So the good news in taking care of older people is they have so many other conditions going on that contribute or occasionally even cause the incontinence that if you address those first, the incontinence can go away.
Okay, some signs and symptoms of urinary incontinence. The loss of urine when sneezing, laughing, coughing, lifting, etc. Bedwetting, frequent urination, and not being able to make it to the restroom without having an episode of urinary incontinence.
Okay, how is urinary incontinence diagnosed? To diagnose your cause, the doctor will first do a physical exam and ask you about your current and past health. So some tests for this would be urinary and urinalysis and urine culture, which shows if you have a UTI, blood or sugar in urine. A bladder stress test stimulates the accidental release of urine. A pad test shows how much urine is leaking. An X-ray or ultrasound examines changes in the bladder and urethra. Urodynamic testing is done if surgery is being considered or treatment hasn't worked. This is also one of the most specific tests. It identifies the exact type of um, urinary incontinence that you may have. And the next one is electromyogram. So this records the electrical activity of muscles. Cystoscopic exam, it allows the doctor to see inside the urinary tract with a lighted tube. And cystourethrogram are x-rays of bladder and urethra while urinating. Um, the treatment for urinary incontinence. The treatment depends on the type of incontinence you may have and how much it affects you. So the first treatment would be bladder training or time urination. Um, the next one is pelvic floor exercises. This straightens the muscle that controls the flow of urine. Medicine might be provided like alpha blockers or topical estrogen. Changes in diet, medical devices like pessary for women. This helps with bladder control, and catheter for men. It empties bladder and control leaks. And surgery um, for if the treatments aren't working. So some nursing interventions would be bladder training. This is to hold urine after you get the urge to go. Double voiding, urinating, then waiting a few minutes and try it again. Schedule toilet trips. To urinate every 2 to 4 hours rather than waiting for the need to go. Fluid and diet management. This is to gain control of your bladder. Um, Avoid alcohol, caffeine, and acid foods. Monitor patients for dehydration. Dehydration can intensify urine loss. And limit fluid intake 2 to 3 hours before bedtime. So fluid intake and voiding before bedtime reduces the need to disrupt. So the importance of responding immediately to patients' requests with voiding is functional continence is promoted with responding promptly with voiding, and advise patients or reusable insert pads. This is to contain urine or double incontinence.
So we have our quiz. We have 5 questions on our quiz. So question number 1 is, what is the test that identifies the exact type of urinary incontinence? Number 2 is name 4 treatments for the diagnosis. Number 3 is, what type of incontinence results in loss of urine after sneezing, laughing, or coughing? Number 4, when should you report blood in urine to the nurse? And number 5 is, what part of the urinary system holds urine before it's eliminated? So we'll give you a second to write down your answers. All right, so here is the answers. So urodynamic tests for number 1. Number 2 is surgery, medicine, bladder training, and changes in diet. Number 4 is stress incontinence. Or number 3 is stress incontinence. Number 4 is immediately. And then number 5 is the bladder. And that is the end. Thank you.